Fiji and the Philippines, two island countries that are on the same boat when it comes to HIV/AIDS. They represent some of the steepest increases in new HIV infections globally in the past 10 years. Both countries are falling short of the global UNAIDS 95-95-95 healthcare targets. And both are figuring in health lists that no country wants to top. Fiji has the world's fastest growing HIV epidemic. Around 12,000 people are living with HIV.
A country of less than 1 million people, this is very significant. And perhaps for me is the most greatest crime and shame of all, because this is all preventable.
The findings don't look good. 1 in every 60 adults is HIV positive. Rates in women are increasing. 1 child is born with HIV every week. 1 child dies to HIV-related matters every month. And the Fiji crisis is driven by intravenous drug use or via needle sharing.
I think it's important for us to really talk about what is happening here in Fiji, because it is a lesson of what can happen everywhere else in the world.
The Philippines, on the other hand, has been identified by UNAIDS as having the fastest growing HIV epidemic in the Asia-Pacific region. Last March, the DOH recorded 4,633 newly diagnosed HIV cases, or an average of 51 new cases per day. Unlike Fiji's Syringe crisis, new infections in the Philippines are tied to sexual transmission. Young people are bearing the brunt, with individuals aged 15 to 34 accounting for nearly 80% of all new cases. DOH tracks an average of 51 to 57 new cases diagnosed every single day. The total estimated number of Filipinos living with HIV has now reached 288,000.
The challenge is almost the same when it comes to stigma, discrimination, challenges to accessing treatment, support, care, and prevention, and all of these things.
And it doesn't help that the world is affected by health funding cuts. Fiji is being helped by its neighbors, Australia and New Zealand.
Responses to HIV are strongest when they are community-led.
A situation that's likely to or has the potential to spread across the Pacific. We recognise that we are neighbours. Australia is neighbours to the Pacific Islands and to also Papua New Guinea, where they see an incredibly high caseload as well of people living with HIV. So we see our role as integral to being able to provide that support and assistance.
The Philippines, while being assisted by the USA, has been benefiting from strong community groups.
One lesson is clear. Communities must be involved in the response. Communities are not just beneficiaries of the HIV programs. We are the indispensable partners towards ending the epidemic.
The challenge now is to continue the battle against HIV/AIDS despite the massive funding cuts worldwide. Take the case of what's happening in Africa. They were shocked and affected by the funding cuts, but is now adjusting to continue their HIV/AIDS programs.
We are looking at policy shifts, MOUs are being signed, a lot of African organizing is happening.
It's not a lack of will, but it's also just that we have to do those adjustments with the practical reality of the resources at our disposal. So we do acknowledge that there are shortcomings, but I can assure you that it's not as a result of a lack of will.
Jovenal Francisco reporting from Rio de Janeiro in Brazil.